which right side of the head, your left side will be paralyzed. Or if you have some stroke in the left side, right side will be paralyzed. So it is important to identify what kind of stroke has happened and what are the symptoms and how we can quickly recover. So time is very important here. A stroke happens within next to 1 hour or 2 hours. We need to do the treatment, otherwise the patient will have severe implications. So, like I said, stroke is the second largest killer disease in the world after heart disease, and then so therefore roughly 6.2 million people uh, die annually, and 100 million people get disabled over the years. So after stroke is around 10%, and heart disease is around 13%. That is the most killer diseases that we need to handle. And men and women slightly different ratio. So men is slightly higher prone to stroke compared to women. And as you get older and older, the probability of getting a stroke is higher. Although it doesn't mean that what age. There are cases between 30 and 50 people also get stroke. So what are we talking about? Stroke can be multiple types. So as the picture shows here, stroke can be a blocking that happened in one of the veins, like the picture shows. Then certain part of the brain doesn't get blood, so therefore blood and hence oxygen. So that part of the blood doesn't supply oxygen, therefore the blood, the actual brain cells will get damaged, or one of the veins vessel could break, and therefore also blood can flow into the brain, and then we can. So this is called a ischemic shock, and this is an hemorrhagic shock. So as the name says, an ischemic shock, one of the vessels will get blocked, and then we don't get enough supply of oxygen in the brain, whereas one of the vessels get broken and the blood flows into the brain, and then brain cells get damaged. So both are destructive type of process. So we need to identify what kind of hemorrhage. There are about 80% again. There are different categories, which we will not go in this lecture. So there are, once this stroke happens, there can be some facial asymmetry. Like I said, if the right side gets affected, your body, left side get paralyzed, or your right brain or the left brain get affected, or the stroke happens on the left side, then right side will get affected. So you can see a visual asymmetry or some speech disturbance or the arm weakness can come. So this is so we need to act very quickly, otherwise more and more brain get damaged. So therefore we need to collect it fast. Okay, facial asymmetry, and speed is very important in this and how much area get affected. So we can do a visual examination of patient and then make a decision quickly. So that's what a test subject or external we take some sensor data, looking at the facial video or arm motion, or we can process this information and quickly make a decision on what kind of effects it may. Since it is inside the brain, we cannot use traditional imaging techniques. You might have used or heard about X-ray imaging, which is a projection image, but we cannot use it for CT because we are not able to see what is going on inside. A projection-based imaging, we can use it for some kind of fraction within a larger part of the body, but in the case of brain, we need to do a slice-wise. So there are various kinds of tomography images, like in the picture shows. We take it in CT imaging. So that means every part of the slice of the brain we take pictures using a. I won't go into the details of how it is done. It's a very complicated steps. So we can do an axial view or sagittal view, or so we have hundreds of images coming from one CD, and then we need to analyze each and every slices. So this is a typical CD imaging machine look like. So here we have one demo. I will quickly play this. So we have the CD that has been installed in an ambulance. So nowadays modern cities have CD installed, a portable CD is installed within the ambulance itself, so that a very quick decision can be made within the ambulance itself. So there are various types of MRI imaging. So MRI, CT, or PET imaging. So we will focus only on CT type. So this is how a machine look like inside the with as a, let's see. So this, just a second. Okay, so some issue with the actual view. So we rotate the machine and we take pictures at the various slices of your body, and then we analyze those series images. So how can AI can help in this case? So we have a lot of slice-wise images coming. Then we need to classify these slices into multiple classes. There is a leveraged image or a Asian image and normal case. So we need to train the model with this data, and then a subsequent subject comes, we can do prediction and make a quick decision. So, just a second. So in this case, if you look at the CT imaging process, the patient go inside, and then we rotate the frames, and then either using a special properties of FFT and other things, we get the various imaging. So in this case, we won't go into the details of actual mathematical process. However, we get the images, then we do a model training. So how do we classify, or how do we personnel, like nurses and doctors, and they look at all the data where the patient's history. And in an automated AI world, we have less human resource required. The computer does most of the job, and then a doctor makes the final decision with the help of the. So, computer doesn't make the full decision. However, it helps the doctors to make the decision. So that's why the number of personnel required 90% accuracy, we are able to predict evaluation metrics that is used in our model case. And we have tried various models, and we are just reporting the numbers. So this product has been published, so I just can look at it. So once the patient has been classified into which CD based on his CD analysis, an hemorrhagic or ischemic case has been identified, we need to plan for a treatment. So for that we need to do analysis or affected. So if you look at the actual internal controlled arteries, we can see that okay, some part has been affected. So we need to identify which vessel we have a problem. So in this picture, we are showing that there is a blockage that has happened and then we need to remove that particular block. So it is a complicated process. So this is what it is normally done. So I'll show you a video of how it is done. So we need to analyze each and every slices using CT and to analyze each and every slices using CT angio. So CT angio contains 100 images. So in this case, we have around 600 slices. So what you are seeing is a slice of a particular patient from bottom to top. So that means this is the neck area, and this animation shows all the slices of the image all the way to the top area. So you can see that various white dots here, a patient gets a stop, and then his blood circulation. We need to analyze what is the current blood circulation that is happening and in the brain now. So this is called a collateral scoring. So based on the current blood circulation level, whether we decide if the patient should go to a mechanical thrombectomy or the operation that I am shown. So, what is the step? And a radiologist or doctor assesses based on. So here it is showing various images that is coming from the CT angio. So this is from the top and the bottom, the neck region. And we take all the images, all these slices, and then we analyze individual slices, and then we do a collateral scoring for individual slices. So what is the collateral scoring? How much is the blood circulation that is happening at the current slice? So once you acquire that knowledge, so then we put together all the images and finally come out with a one number which is from between 1 to 10. So in this case, if you look at this particular picture, you can see that some of the slices may not be relevant, so the top and the bottom. So we'll focus on this part of the slices. Okay, so the top is ignored and the bottom is also ignored. So we look at only the middle part where the stop has happened. So this is a sagittal view of the brain at the moment, where exactly each of the every images we take it and then we do a symmetry analysis. So in this case, we come out with this is a very complicated steps. Damage has already made, then there is no point in going. Damage has already made, then there is no point